Hello everyone, I'm Mikhail Sorokin. Today we'll discuss how to prevent pelvic tilt. Many people are now facing this issue, but few understand what the main essence of this phenomenon is. Basically, pelvic tilt is a functional disorder of the musculoskeletal system, meaning it describes the difference in function between the left and right legs. That is, how you push off with them and how you rely on them. In most cases, we can visualize this by looking at the height of the upper anterior iliac spines of the pelvic crest. But actually, the main functional point is the range of extension in the hip joint. So the part of the iliac crest that is lower is usually the one that loses the end of hip extension during the final phase of the step. As a result, we start using not hip extension, but additional extension in the lower back. On one side, a little more than on the other. This phenomenon is very difficult to notice because we are constantly in a seated position, we sit a lot, and we have poor awareness of the muscles of the anterior abdominal wall. But there are simple exercises that you can include in your daily routine gymnastics or add at the beginning of your strength workouts. In order to monitor and prevent this phenomenon, our exercise will be performed in a lying position. Since first of all, with any sign of pelvic tilt on the weak side, that is, where the iliac crest is lowered, the end phase of hip joint extension will primarily be lost. We need the ability to check and improve the end of the range of motion. In most bilateral exercises, it's difficult to control this due to the possibilities of lumbar movement and compensatory mechanisms. That's why for this exercise we lie on our back. To start, we can begin with either leg so that you can compare the strength and range of motion. We lie down completely, pull one knee toward ourselves, grab it with both hands and bend the knee until we feel the lower back start to flex. If you feel discomfort in your knee, it's not a problem. You can use a grip under the knee or use an additional strap if, for example, your belly gets in the way. From this position, we straighten the leg so that the big toe is pointing up toward the ceiling along with the foot. The head is lying down completely. The shoulder blades should be brought together, and after that, we start to push hard with the heel into the floor, as if trying to lift the pelvis above the couch. I hold the effort for about 2 seconds, and after that, we slowly lower ourselves down. In this way, you should do about 10 repetitions at a time. At the same time, if you feel discomfort under your knee or in your lower back, it's not a problem. With the help of your leg, like a joystick, you can adjust your position. For example, if you feel discomfort in your lower back, you can, for instance, pull your knee a bit closer to yourself or move it slightly outward. If you feel discomfort, for example, under the knee of your straight leg, you can turn the bent knee slightly more inward. In this way, by controlling your other leg like a joystick, you can fix the position of your pelvis in the most comfortable position for you. So, it's best to check both legs for extension strength. This way, you can check whether you can push off and lean equally on each leg. If you notice any significant difference, then in that case, focus on the weaker leg. You can do this for a month. This exercise should be done in 2 or 3 sets, about 10 repetitions each, with a pause of about 2 or 3 seconds. If you are doing any strength or complex traditional workouts, you should add a couple of sets at the beginning of each of them, until the strength and range of motion of the push feel the same on both sides. As a preventive measure, you can simply add it to your workout warm-up or, for example, your morning exercises. This exercise requires quite a bit of effort, so don't worry if you can't lift yourself up at first. For example, fully lifting your pelvis off the floor. This might be normal, but ideally, you should set this as your goal, so that you can push off with each straight leg individually, even if it's just a minimal range of motion, that is, in the format of lifting your pelvis off the floor. Despite the difficulty of this exercise, don't forget that your leg is your supporting limb. It needs to be strong to stay healthy. Subtitles created by